All right, so before I start my assessment, I'm going to wash my hands and I'm gonna gather my supplies. Next, I'm just gonna do a general assessment from the door. So I'm going to look to see if the patient looks good or looks bad. Overall, she looks pretty good. I'm also going to check the behavior. She seems to be happy interacting with her parents, and also just her general health, and she seems to be overall healthy and stable at this time. So next I'm going to enter the room. When I enter the room, I'm going to provide privacy, and then I'm going to start by introducing my patient. So, hi Jenny, my name's Ashley, and I'm going to be your nurse today. Can you tell me what your name is? Perfect. And can you tell me what your date of birth is? All right, perfect. So what we're going to do today is we're just going to do a head-to-toe assessment, make sure your body's working and doing everything it's supposed to, okay? Do you have any questions for me? No? And Mom and Dad, do you have any questions for me? No questions. All right, so we're going to start with the vital signs. So we're going to begin with the apical pulse. So we're going to listen to the heart rate. I'm just going to warm this up. All right, so normal heart rate for Jenny is going to be between 60 and 90. Next, we're going to listen to or check the respiratory rate. So respiratory rate is going to be between 14 and 22. Hers is a little bit high. Next, we're going to check the temperature. So temperature for Jenny, we want to see it around 37 degrees Celsius, which looks good. Next, we're going to take her blood pressure. So for her blood pressure, we want to see a systolic rate between 110 to 120, and then her diastolic rate is going to be between 60 and 75. And she's got a little bit elevated blood pressure right now. So after the blood pressure, we are going to do a pain assessment. So Jenny, on a scale of 0 to 10, can you tell me what your pain is? 0 being no pain at all, and 10 being the worst pain you've ever felt. Okay, so she's states that she has a 4. So if the patient was under 3 years old, we would do the circumference of the head. For Jenny, it's not going to be applicable, but we are also going to do a height and weight for Jenny. And that's it for vital signs. So next we're going to go on and do the neurological assessment. So for neuro, we are going to first check the level of consciousness. So she's alert, she's awake, so our LOC is good. We're going to do orientation. So Jenny, can you tell me where you are and who's with you here today? Mom and Dad, and do you know why you're here? Okay, so because she's sick, so she is oriented. Next, we're going to check the Glasgow Coma Scale, and so she's at a 15, which is normal, is what we want to see. Next, we're going to do Perla, so we're just going to be checking the eyes, checking to make sure that they are round, equal, pupils are equal, round, reactive to light, and accommodating, and also going to do the opposite. This, okay, so Perla is intact. If she was an infant, we would check the fontanelles. Once again, that's not applicable for Jenny. And we're assessing the speech. She is communicating with me and Mom and Dad, so her speech is good. So after neurologic, we're going to do cardiac. So for cardiac, we're going to listen to the 5 heart sounds. Okay, sounds good. We're also going to check the pulse. So I'm going to, careful of her IV, but I'm going to check her radial pulse bilaterally, and then as well as her pedal pulse bilaterally. I'm also going to check the capillary refill of all the extremities, wanting it to be less than 3-second capillary refill, as well as edema in all the extremities. So checking edema, everything looks good. So I'm also going to check for diaphoresis, so she doesn't seem to be sweating, and then I'm going to check her IV site. So her IV is over here in her right hand, checking for any infiltration or phlebitis. Next, we are going to do pulmonary. So we're going to listen to the lung sounds. We're going to have 3 on the front bilaterally. And then at this time I would have Jenny sit up so that I can do the 3 on the back. And then that's also going to be bilaterally. And then I'm going to do on the sides as well, 2 on each side. So after I checked, listen to the lung sounds, then I'm going to check for cyanosis. So just checking the coloration of her skin, making sure there's no blue coloration. I'm also going to check the effort of breathing, so checking for any retractions or nasal flaring. So after pulmonary, we're going to do gastrointestinal. So gastrointestinal, I'm just going to first assess the abdomen. I'm also going to look for any distension. I'm going to then auscultate the 4 quadrants of the abdomen and listen to the bowel sounds. Okay, I'm also going to palpate the abdomen. So I'm checking for any tenderness. And then I'm also going to be checking if the abdomen is firm or soft. Everything seems to look good. I would also ask Jenny when her last bowel movement was. I can also ask mom and dad. And then I'm going to ask Jenny if she has any nausea or vomiting. So do you feel like you're going to throw up, or have you thrown up? So she complains about a little bit of nausea. So next we're going to go on to the genitourinary. So last time you went pee, did you smell any bad odors, or was there any discomfort? No. And then also, was it clear and yellow? So yes, everything looks good there. Next we're going to go on and do the musculoskeletal. So what I'm going to do for that, I'm going to carefully do range of motion of all the extremities, like wrists, elbows, shoulders. Same thing for the feet. As I'm doing this, I'm also making sure she has normal movement of all the extremities. Next, I'm going to check the grip bilaterally. So we just squeeze my hands. Perfect. So I'm checking her grip as well as her strength at this time bilaterally. So that looks good. I'd also have Jenny get up and walk for me so I can check her gait, make sure there's no abnormalities there. And then I'm also going to do plantar and dorsal flexion. So just put your foot up towards your head and then push it down away from you. Okay, perfect. Looks good there. And let's see, I think that's it for musculoskeletal. So next we're going to do skin. So for the skin, I just want to check to make sure the skin is intact, it's moist, the color and the temperature is good. I'm also going to check for skin turgor. So we can just pinch the skin, check for any tinting. She's a little bit dehydrated based on this increased skin turgor. I'm also going to be checking for, I'd have her open her mouth. So Jenny, will you open your mouth for me? Just going to look in her mouth for pink and moist mucous membranes. Because a little bit dehydration, she has a little bit dry mucous membranes. And make sure that there's no bruising or skin breakdown as well. Next, we're going to do psychosocial. So I just want to make note that she is cooperative, she is calm, and not irritated, and she is talkative. So she's communicating with me as well as the family. So next, we just want to do some patient teaching. So because she has diabetes, just want to teach you some ways to make sure that you can control the diabetes. So diabetes just means that you have a hard time, your body has a hard time working with those sugars and getting them broken down and used in the appropriate manner. So what you need to do is make sure that you really watch your sugar intake. So make sure you're not eating lots of candy or lots of drinks that are high in sugar. And then when you are giving yourself the medication, or mom is, make sure that you are rotating the sites on your abdomen and not repeating in the same spot. It's also important if you start feeling shaky or or dizzy, that you tell mom so that you can check your blood sugar so that you can get that medicine in you to help get your blood sugar where it's supposed to be. So do you have any other questions? Mom, Dad? No? All right, so next we're going to go ahead and give the medication. I've already drawn it up so it's ready. And I don't think I have any gloves. Oh, we do have gloves up here. So before I administer any medication, I'm going to state the 6 rights. So first we're going to check, make sure that it's the right patient, the right medication, the right route, the right dose, the right time, and the right documentation. So insulin is one of those that you need to have a double check. So I would have another nurse come in and check to make sure that I have the right amount. So I have this all ready to go. I already have 4 units of the NPH, and then I have 2 units of the regular, and we are going to give this sub-Q. So I'm just going to put this here as if this is the skin. All right, Jenny, so this is just going to help with your blood sugars. It's just going to be a little poke, but it shouldn't hurt too much. So a couple side effects for insulin is your blood sugar might get too low, so you're going to have some shakiness, fatigue. So you also might get a headache as well. So we're just going to clean that site real quick. And then, okay, so easy enough. And then I would put this in the sharps container. Actually, I don't know if we're supposed to get rid of it. Okay, and then next, for the pain, we're just going to give you some acetaminophen. So that's Tylenol, and that's just going to make your pain go away. And a side effect to that is that you might get a headache or you might have insomnia. And insomnia just is a fancy word that means that it's going to be hard for you to sleep. Okay, so this is just going to be something that you could drink. It doesn't taste bad. So I would just draw up my mils. It's 9.9 for her weight, and then I'd have a drink of water and just give her the medication. So after patient teaching, side effects, I'm going to just remove my gloves. I'm going to wash my hands, and then I'm going to make sure that the patient is safe and comfortable, put up any bed rails that I need to, and then I'm going to clean my area, make sure I'm leaving the environment neat and clean. And that's the end of my assessment.